Attention Deficit Hyperactivity Disorder in adults, ADHD. Adult Attention Deficit Hyperactivity Disorder, ADHD, is a mental health disorder characterized by a number of persistent issues, including difficulty paying attention, hyperactivity, and impulsive behavior. Adult ADHD can cause relationship problems, poor work or school performance, low self-esteem, and other issues. Despite the fact that it is referred to as adult ADHD, symptoms begin in childhood and continue into adulthood. ADHD is not always recognized or diagnosed until a person is an adult. Adult ADHD symptoms may be less obvious than ADHD symptoms in children. Adults may experience less hyperactivity, but they may continue to struggle with impulsiveness, restlessness, and difficulty paying attention. Adult ADHD treatment is similar to that of childhood ADHD treatment. Adult ADHD treatment includes medications, psychological counseling, psychotherapy, and treatment for any co-occurring mental health conditions. Signs and symptoms. While some people with ADHD experience fewer symptoms as they age, some adults continue to experience significant symptoms that interfere with daily functioning. Adults with ADHD may experience difficulty paying attention, impulsiveness, and restlessness. The severity of the symptoms can range from mild to severe. Many adults with ADHD aren't aware of their condition, they just know that everyday tasks can be difficult. Adults with ADHD may struggle to focus and prioritize, resulting in missed deadlines and missed meetings or social plans. The inability to control impulses can range from impatience while waiting in line or driving in traffic to mood swings and angry outbursts. Among the symptoms of adult ADHD are impetuousness, disorganization and difficulty prioritizing, ineffective time management abilities, problems concentrating on a task, having difficulty multitasking. What is the difference between typical and ADHD behavior? Almost everyone has ADHD-like symptoms at some point in their lives. If your difficulties are new or have occurred only infrequently in the past, you most likely do not have ADHD. ADHD is only diagnosed when symptoms are severe enough to cause persistent problems in more than one area of your life. These bothersome and persistent symptoms can be traced back to childhood. Finding ADHD in grown-ups can be troublesome on the grounds that specific ADHD indications are like those brought about by different conditions, for example, tension or disposition problems. What's more, numerous grown-ups with ADHD additionally have at any rate one other emotional wellness condition, like wretchedness or tension. When to see a specialist? In the event that any of the manifestations recorded above constantly disturb your life, converse with your PCP about whether you may have ADHD. Various sorts of medical care experts may analyze and direct therapy for ADHD. Look for a supplier who has preparing and experience in focusing on grown-ups with ADHD. Causes. While the specific reason for ADHD isn't clear, research endeavors proceed. Elements that might be engaged with the improvement of ADHD include hereditary qualities. ADHD can run in families, and studies show that qualities may assume a part. Climate. Certain natural factors additionally may build hazard, for example, lead openness as a kid. Issues during advancement. Issues with the focal sensory system at key minutes being developed may assume a part. Risk factors. The danger of ADHD may increment if you have close family members, like a parent or kin, with ADHD or another emotional well-being problem. Your mom smoked, drank liquor, or utilized medications during pregnancy. As a kid, you were presented to natural poisons, like lead, discovered primarily in paint and lines in more established structures. You were conceived rashly. Entanglements. ADHD can cause problems for you. ADHD has been connected to helpless school or work execution, joblessness, monetary issues, the issue with the law, liquor or other substance abuses, regular fender benders or different mishaps, insecure connections, poor physical and psychological wellness, helpless mental self-view, self-destruction endeavors, other psychiatric conditions, other mental issues, Grown-ups with ADHD are at increased danger of other mental problems, for example, behavioral conditions, discontinuous dangerous issues, and substance use issues. Learning disabilities. Grown-ups with ADHD may score lower on scholarly testing than would be normal for their age, insight and training. Learning handicaps can incorporate issues with comprehension and conveying. Conditions that coexist. Although ADHD does not cause other psychological or developmental problems, it is common for other disorders to coexist with ADHD, making treatment more difficult. These are some examples. Mood disturbances. Many adults who have ADHD also have depression, bipolar disorder, or another type of mood disorder. While mood problems aren't always caused by ADHD, a pattern of failures and frustrations caused by ADHD can exacerbate depression. Anxiety problems. Anxiety disorders are relatively common in adults with ADHD. Anxiety disorders can result in excessive worry, nervousness, and other symptoms. Anxiety can be exacerbated by the difficulties and setbacks associated with ADHD. Other psychiatric problems. Adults with ADHD are more likely to develop other psychiatric disorders such as personality disorders, intermittent explosive disorder, and substance abuse disorders. Learning difficulties. Adults with ADHD may perform poorly on academic tests despite their age, intelligence, and education. Learning disabilities can cause difficulties with comprehension and communication.